Ear polishing is an easy way to remove stain from patients' teeth. It's very atraumatic when done correctly. Ear polishing utilizes pressured air and water in a stream along with a slurry of sodium bicarbonate to effectively polish the teeth without trauma. It's effective, safe, and very easy to use. It's definitely an ergonomic alternative to using prophy cups and paste. The ear polishing handpiece is also a great addition to any office armamentarium. It's portable, can move from one operatory to the other, and you will have great use for it in many procedures.
What are the indications for use of this material?
Ear polishing is great for stain removal, especially with all of our patients that have chlorhexidine stain. With periodontal treatment, it removes it in a snap. It's also great for cleaning pits and fissures prior to sealant. Interproximal scaling is a breeze, and when you have those ortho patients coming in, it's so easy to clean the ortho brackets and braces and everything. Patients come out shining away. Starting the day with the Bosworth Air Polisher is very simple. You remove the nozzle from your autoclave bag, attach it on the unit, and then place this on your operatory unit. The greatest thing about the Bosworth Air Polisher is its portability. It can go from any operatory to any operatory. It could be in the hygiene room, then it can go into the restorative area, and there's no other connections except your own handpiece line. You open up the top of the chamber, there's a fill line. You take your powder, shake it up a little bit, place the powder in the chamber, tightly close the chamber, and you're ready to go. The air polishing procedure, it's prudent to use some lubricant on the patient's lips. It protects them and also is a little bit more comfortable. After use, open up the chamber of the powder and dump out any excess powder in the trash. What you need to do is take air, only air, blow out the chamber to clean it. You're supplied with wires. In each hole, you want to take the wire and make sure that each hole is open after each use. Remove the nozzle. Take the curved wire, place it in the spray hole, and make sure everything is cleared. If this gets stuck, if it ever gets stuck, take a little bit of alcohol and clear out the inside of the chamber. You can also enter the nozzle from the rear to clean it, and between use or prior to autoclaving, you can leave this wire in to keep clogs free. The most important thing is to make sure that the chamber is clear and clean at the end of every day. No water builds up in there and no clotting powder. If you have clotting powder, you will have a problem with the machine not working. There is a heavier duty wire. It goes into this end. That should also be cleaned out at the end of the day, and the machine is ready to be put away.
Doctor, when would you not want to use this material?
You certainly wouldn't want to use this material with a patient that's on a reduced sodium diet because you are using baking soda. You also would want to make sure that patients don't have any respiratory issues, young children, any patients with renal problems. Air polishers should not be used on patients that have exposed dentum and cementum because you will cause a lot of post-operative sensitivity. You don't want to do that. And definitely you don't want to do any prolonged polishing anywhere near root surfaces.
Dr. Doniger, would you please explain to us in your own words why you prefer the Bosworth Air Polisher?
Well, it's amazing. It's incredibly ergonomic. The nozzle rotates so there's no strain on your wrist. The equipment is totally portable. It can be moved from one operatory to another. It can be put in the operative operatory. You can bring it into the hygiene operatory. It can go from hygiene operatory to hygiene operatory, and there's no installation necessary. It is just inserts right into your existing equipment. It's very lightweight, and the price is well worth the investment.